Thanks, Ruth. So Chris has just given you a really good rundown of all of the headaches that you thought you'd got out of the office and avoided for a day, and you're probably now worried that the guy from Healthwatch England is going to give you yet another headache by talking about all the things that you're worried you're not doing about engagement. I hope by the end of my canter through my presentation it won't feel like that, because, as I say up there, we feel really strongly that getting engagement right is about driving positive change, it's about driving improvement, and it's about doing that in concert with the communities that you're all trying to serve through the Kent and Medway STP. So I'm conscious there may be some people in the room who don't know much about Healthwatch. So just briefly, Healthwatch England is the organisation that leads and supports a network of 152 local Healthwatch who are commissioned by top-tier local authorities throughout England. Here on the Kent and Medway patch, there is a Healthwatch Kent commissioned by Kent County Council and a Healthwatch Medway commissioned by the Unitary Council in Medway. And across the network, as you'll see, hundreds of thousands of people each year get information and advice and help to navigate their way around the confusing system that you'll all recognise. That also gives our network really useful intelligence about what people are finding difficult about accessing services or understanding what's available to them. We also physically go into health and social care services, anywhere where the public pound is flowing, to understand what's going on for people experiencing those services there. So there is a legal power that local Healthwatch have called Enter and Review. It is not an inspection activity, and also typically Healthwatch, by agreement with the providers, go further than that and do a much richer form of service evaluation. And some of our national work has really benefited from that. For example, the couple of reports that we have done this summer on social care, one about people's experience in care homes and one of people's experiences of home care services. That gave us an insight that really nobody else has been able to get from the people experiencing those services because of the way that local Healthwatch use that power and that position in the system. As well as local Healthwatch staff, we have an army of thousands of brilliant, committed volunteers who, as well as doing a lot of the work on the ground, also help make sure that Healthwatch are absolutely rooted in their communities. And we pull together nationally all of the reports that the network generates. So in the past year, that was 1,450 reports. We'll be publishing our annual report to Parliament later this week, and I am expecting you to see a larger number than that. So the network really is understanding now how to gather more, how to share more in a way that partners can make use of. The other thing I want to say before I ask you a Slido question in a minute is that I'm not just talking about Healthwatch. All the examples I'm going to use will be Healthwatch examples because that's what I know most about. But in thinking about public and community engagement, it's really vital, and I know all of our network would say this because in some of the events we've run for them and brought them together nationally with NHS England partners, with people from health and social care all around the country, our network has talked about the importance of working with and through the voluntary and community sector, and about the importance of really embedding this way of working, this approach to engagement, into health and care organisations themselves. So this is not just a Healthwatch pitch, even though the examples will be very Healthwatchy. So could we get the Slido question up, please? Oh, excellent. So one of the things that I was really conscious of listening to Chris, but also from some of the conversations earlier today, is often it can feel to people like nobody wants to be the person in the room that's pointing out yet another problem. So interesting to see the answers up there. Good to see most of you feel it's okay to talk about challenges in public, and hardly any say not really. So I'm not surprised by that, because a lot of the things I heard earlier today, and the sheer fact that you've asked us to come and talk to you, and you also got a workshop in the next session about engagement, suggests that at STP level you understand the importance of this. Can we try the next follow-up question, please, as well? So if you have done that, what happened? All the keen people have answered first. This is good. Brilliant. Well, it sounds like I'm preaching to the choir, which is going to make my life a lot easier for the next 9.5 minutes. Right, thanks for that. If we can go back to the slides. So I'm always conscious when talking about engagement, and particularly in the context for STPs and accountable care that Ruth talked about in her introduction this morning, that the whole concept had a slightly uneasy birth. There was that theme around secrecy. There was an expectation that this was going to be met with potentially riots on the streets. And while we clearly don't think at Healthwatch either that people are in what used to be smoke-filled rooms and are now smokeless rooms, hatching secret plots, or that the public are getting their pitchforks down from out from the barn and marching up the road to their acute hospital to protect it from all comers. I think it's always important for both sides of that conversation to remember there is a reason why those perceptions exist, and one of the reasons why we need really open, honest, respectful and mutually beneficial conversations about the kind of change we need in health and social care is to make sure that we can get beyond the concerns that people have on both sides of that perceived barrier and get on with the improvement journey that we've all embarked upon. So when people do display behaviours or have concerns that relate to that conspiracy theory view of the world or the angry mob view of the world, we end up with a cycle of fear, and everybody loses there because nobody asks the right questions and nobody hears the answers. So part of what Healthwatch tries to do, and the other organisations that have been working hard in different localities to help STPs and ACSs get to grips with engagement. Part of what those organisations are trying to do is to break that cycle and demonstrate the difference that good engagement can make both for system leaders and for individuals and communities. So I'm going to give a plug for NHS England here. We were really pleased to see, after a bumpy start to engagement around STPs, which we were concerned enough about to express our concern publicly. I think having talked to a number of, a wide range of engagement professionals across the country who felt that pieces of engagement they'd been working on had suddenly been guillotined by the introduction of the sort of the pause and the freeze while the STP thinking started. We were really pleased with the response we had from NHS England when we raised a concern about that, and have been working very closely with the team there and helping to get the right work going regionally and through our network in order to really build the right engagement principles into national thinking with a view to influencing regional and local thinking. So the image you can see up there is a shot from the next steps on the 5-year forward view, where we didn't charge NHS England a fee for stealing our 5 steps to good engagement. We were more than delighted that they did. I don't think any of that will come as a surprise to anyone with an ounce of common sense, by which I include everybody in this room, but it was really helpful that NHS England reminded the nation's health and care leaders in that way that sometimes the simplest, most common sense principles are the ones that will get you the furthest. The bit that I've underlined is the expectation that NHS England and NHS Improvement have set that people will get engagement right. And I'll say in a bit why that's really important. The other thing I want to give a plug to is NHS England's guidance for CCGs and others about engagement and participation that came out a while back. It is really practical, it is really useful, it is really important. Do read it. I'm assuming that you're going to get slides circulated after today, so all of the links you can see at the bottom of slides you should be able to click through to these documents. So I said I'd say why I think it's important that NHS England's acknowledged how vital engagement is, and it is absolutely about enlightened self-interest. So this is the section in the Next Steps document that says why are NHS England taking the approach they're now taking to the next 2 years, and you'll see, and this relates to my Slido questions really, some of the things that people have told the Healthwatch network matter to them and aren't currently working for them are the things that NHS England now really wants to focus on in the next 2 years, and is hoping that STPs and ACSs will also do. So the information we have got through our own engagement and where Local Healthwatch have been working to support STP and ACS engagement is also helping to set the national frame in which you at regional level will help to drive the improvement. So I've just got a few points to make about what good engagement looks like and some examples of where people have started to move in the right direction. Firstly, it joins up around people, it gets rid of those three-letter acronyms, it builds trust and starts to build a long-term relationship. So Devon's a good example of that. There are 3 Local Healthwatch covering the STP down there, and what they've done is helped to demonstrate the importance of the independent role that Healthwatch has in relation to that STP. So people have been able to build trust because the communities in Devon have known that Healthwatch, as well as helping to facilitate, have also been scrutinising, being an honest broker and making sure that there is a public commentary on whether engagement is happening and how it's happening. Secondly, it goes where all the people are. So this is another really important point to think about involving the wider voluntary and community sector on as well. It's always been fundamental to Healthwatch that we speak for everybody and work with everybody, not just those who shout the loudest. And in terms of really meeting the needs of all of your communities and every section of your communities, the kind of approach that was adopted in the South West London STP, working with 6 Local Healthwatch, lots of different kinds of events, some organised to invite people to, others going to where people were receiving a service, often a service provided through the voluntary sector. So the homelessness example is a good one there. That's another really important dynamic in all of this. And thirdly, good engagement is creative, and it doesn't forget that there is existing insight. The universe didn't start when NHS England invented STPs. There is lots of rich insight already there that can help both explain to people why you want to have these conversations and help drive the thinking about what the solutions should be. West Yorkshire and Harrogate STP has been a great example of that. Been some really good joint working with the Healthwatch up there, and they've been very creative in the use of digital technology, lots of social media activity, and as it says on the slide, about 140,000 people saw the explainer video about the changes to the ambulance service. A plug for some documents that Healthwatch Kent have produced, so you have got some really good local resources to draw upon. So if you follow that link, you will find those 3 documents, really good guides to engagement before consultation, a guide to good practice during consultation, and also a guide for the public about what consultation means. One of the things we often find around the country is that people are loose in the way they use their terminology. They say that they are consulting people when actually it's engagement. When the consultation comes around, people can then say, hang on a minute, we've already told you what we think. Are you just going to keep coming back and asking us till we give you the right answer? So really important to follow that good practice, and I know Healthwatch colleagues will be really glad to talk to you about that. So as my clock enters the red phase, just to say, if you want to find out more about what other Healthwatch around the country have done, do follow that link to the service change pages on our site. There will also be a section on that on our annual report that will be available on our website on Thursday. And if you've got any other questions that I don't answer in the Q&A bit, then do please get in touch with me.